Right, welcome back. This is our daily COVID-19 updates here on GBC News. I've been joined in the studio by Mr. Augustine Kumah. Mr. Augustine Kumah is from the Center for Adolescent and Women's Health Initiative. Thank you very much, Mr. Kumah. We are grateful you found time this afternoon to join us here on GBC News. Also joining us in the studio is Madam Cecilia Senoo. Madam Cecilia is the Executive Director, Hope for Future Generations, Ghana. Later on, we'll be joined by Dr. Anthony Ofosu, Deputy Director of the Ghana Health Service. Our focus this afternoon in this segment is how to deal with other infectious diseases. Let me start with you, Mr. Kumah. So, what are these other infectious diseases that you believe we should be talking about, even in all the other conversations we have been having around COVID-19?
All right. Thank you so much. Thank you for having me. But I want to say that I'm a youth leader for health on the Youth Leader for Health program.
Okay.
The Youth Leaders for Health program is a 1-year program that is being put together by Results UK and then being hosted in Ghana by Hope for Future Generations. And this program is run in 3 other countries. We have Tanzania, Sierra Leone, and Ghana, where youth leaders are selected to work especially in the area of malaria, advocating for increased domestic resources to tackle malaria issues. So on the issue of COVID and other infectious diseases, I would like to specifically base my conversation on the issue of malaria. And so we can all see that when COVID came, attention has been drawn away from other diseases, and we've not been talking about them. We have malaria as an example. Since the era of COVID with us in Ghana, we've never had updates on malaria as we normally have on COVID. And you realize that people still go to the hospital with malaria cases. People are still sick day in, day out with malaria and being diagnosed, and people die as a result of malaria. So you realize that the impact of COVID now on malaria is and other diseases as well. We have TB as well. We have HIV as well. It's been great. The issue here is that why should malaria program be interrupted or stopped? Because we have people who die of malaria. Now we need to have a strengthened health system, and then strengthened health system here I mean by we having a system that can ensure access to healthcare, one, not only healthcare but quality healthcare, and then a system that can quickly respond to these other infectious diseases, as example malaria, and then can respond to the epidemiological changes as well. So a typical example here is that yes, COVID has come, malaria has these issues, and interventions have been disrupted. No attention has been paid to malaria for a while now. We don't know how many cases or mortalities we have as a result of malaria for the past quarter, taking from January to now. We don't know how many cases as in new cases that we record each day or each time, or even for the past quarter. We don't know what other interventions are being put in place to tackle issues of malaria. Mind you, malaria presents with fever as well. So people go to, and as a result of the COVID, we test for fever, malaria, temperature. When you walk, even when I was walking in here, I was checked for my temperature. And somebody with malaria will also present with temperature, high body temperature. So you realize that, look, the moment the person has high body temperature, the person could even be, the first impression that would come in mind to whoever is attending to a person would have been that maybe a suspect of a suspected case of COVID-19. So these are issues that we really need to look at, and then really look at how best we can put our systems in place so that in times of emergencies as COVID-19, other interventions to other diseases is not disrupted.
You have a very good point there, but you see, coronavirus is this, and before I bring Madam into the picture, coronavirus is described as novel, and so even the scientific world still does not understand its workings and its mutations and so on for a long period of time. Malaria has been with us. There is at least a known cure for malaria. There is now a vaccine, so we hear, for malaria. There is not, and malaria, yes, it's an infectious disease, but it does not spread from person to person. It is not, quote and unquote, as dangerous as coronavirus. So in a conversation or in a period where we are dealing with the unknown, you're saying, well, let's share the same amount of space and deal with what we already know. We have a malaria control program in Ghana that has been running for years. What else is there to discuss about malaria?
Yes, you have a point there, and that malaria, interventions has been with us, and then we know treatment. We have treatment for malaria. We know how to tackle malaria. Yes, it is true, but then the issue we are discussing here is that even as we are looking at COVID as an emergency, let's not forget about the other cases, infectious diseases that are also killing. Mind you, when you look at the 2019 World Malaria Report, over 400,000 deaths occurred as a result of malaria. And so if we are looking at over 400,000 deaths that are occurring, and we think that it is not an issue for us to look at, even at these times, then maybe we'll be mistaken. You see, we are not saying that attention shouldn't be paid to COVID-19. Attention should be paid to, yes, it's novel. We are still trying to find issues around it and make more researches into it. But then let's other programs. There should not be any disruption in other programs that are equally killing people. Pregnant women are affected most. Children under 5 are affected most. And so, but with the rate at which even COVID deaths and malaria, we should still continue with programs that are running for malaria. And man, even with the National Malaria Control Program, it should surprise you to know that funding for that program has been reducing year in, year out.
Okay, I'll come back to you, Mr. Kumah. Madam Cecilia, tell me, has anything changed in respect of the attention, the amount of attention that has been paid to other infectious diseases, and Mr. Kumah has been emphasizing particularly on malaria? Has COVID-19 taken away that kind of attention?
Yeah, thank you very much. Yes, COVID-19 has taken a lot of attention. I will also look at it on the resources, especially when you look at the way everybody is supporting COVID-19 with resources. If we pay the same attention to all other interventions, especially our health system in the past, I think we would have been somewhere higher than where we are now. We would have built very resilient and sustainable systems for health to stand every disease. And also, if you look at every day, have we ever heard the president briefing us as a country on state of health? No. But COVID-19, I saw that zeal and enthusiasm, which is very necessary that our health system, our health sector should be given that attention. Because without a strong health system, I think a lot of diseases, anything, such emergencies will come, it will be found wanting. And then, if you look at immunization, if you look at, apart from malaria I talk about, now a lot of children are not being immunized because COVID-19 has come. And so mothers don't send their children for weighing again. If you look at HIV, TB, yes, something is happening, but a lot of defaulters. Ask me why. A lot of people don't want to go to the facility because they are afraid that COVID-19, if you go there, you'll be exposed. Especially when we had the lockdown, a lot of people, because of, UNS did a research, and from the little research that a survey that we saw, the defaulter rate among people living with HIV, especially young people, is rising. And so you realize that there is attention, most of the attention has been shifted. Everybody is talking about COVID-19. Meanwhile, we have a lot of people getting infected with HIV. The same with TB, which is airborne, similar to what COVID-19 is happening. So I think, one, we have the challenge of gaps in funding, we have challenge of resources, and we have challenge of attention being paid to COVID more than any other disease, and that is our worry.
And so, if you were in charge, what would you have done differently? Because you have, and like I asked Mr. Kumah, a disease that the scientific world is still struggling to come to fully understand. Yet you talk about TB, you talk about malaria and other infectious diseases. The world understands these diseases. They've been with us for quite some time. We know how they work and affect people, but this one we don't. And so if you were the one in charge, you would probably take the same decisions, wouldn't you?
I will take the same debate. I will look at other areas that kill people. I think the important thing is that who are the people most affected with other diseases? Because if our children die of malaria, if our pregnant women who are carrying the baby die of malaria, and a lot of attention is paid on COVID, then by the time COVID finishes, or maybe we find vaccine for COVID, you will come back and start thinking, how do I address those other diseases? And so I think we need to really balance the whole thing to see that a lot of attention. I already mentioned that I think the challenge, our health system, I think a lot of things, we've been talking about stronger health system, but I have not heard so much talks about stronger building resilient and sustainable system for health until this COVID-19 has come. And I think that if we start thinking like the way we think during COVID-19, we will not be found wanting, because whether we like it or not, other diseases, other emergencies will come. And are we going back again? Because during Ebola time, a lot of work was done and we didn't have it. But I think that the moment we start investing into our health system, ensuring that our health system is sustainable. Sustainable means that adequate resources to strengthen the health system, the human resource, because health system is not just infrastructure. I always talk about that. Humans, commodities, everything. If we start looking at it holistically, I think we should be able to test the test of time, so that when any other disease comes, we should be able to stand. We should really learn from what is happening. Yes.
Mr. Kumah, you spoke about the number of people who are affected annually, 400,000. Yeah, but you also said that we haven't been able to get the figure for the first quarter of the year in Ghana. How did you arrive at 400,000, and how come the same system has not been able to help you to get the figures for 2020, for example?
So the figures I mentioned, as I said, that was from the 2019 World Malaria Report from WHO. And now, see, you talked about the fact that we know how to tackle malaria, and as colleague has said, by the time COVID would be gone, we'll be faced with other challenges. Going back, looking at the havoc maybe malaria, TB, and HIV/AIDS would now be causing. So here, the strategy I think that we should adopt here is the balance system, where yes, we are looking at COVID, we are looking at other infectious diseases. The health system, as they are saying, for example, we are doing community detection for COVID. Mind you, malaria as it is can have such an intervention also. Do you get it? Now we are looking at fever to suspect as an indicator for suspected cases of COVID-19. Now fever also is an indicator for, let's say, for example, malaria, because when somebody walks into the health facility and presents with fever, maybe with other questions that will be asked, other signs and symptoms, they will say, okay, let's test you for malaria, and it could be positive or negative. Now for the community detection that we are talking about, and then COVID that we are now using as a means of we are using community detection for testing COVID. The same measure can be used for malaria. We can equally go to the communities, or even cases that are presenting to us in the facility. We can do what we call just as the case classification that we looked at, whether for COVID, whether this case is an imported case or not. Malaria also can be an imported case. So when we looked at all these strategies, let's say we have a case classification for malaria cases as we do in the facilities, it can help us also do same contact tracing or community detections as a way of tracking malaria. But all these interventions are not being done. Do you get it? Now attention is only on COVID. Take TB for example. The measures that have been put in place, let's say the lockdowns and co, mind you, it is preventing someone from getting TB medication. Do you get the point? Now the fundings are all diverted into COVID management, forgetting that medications have to be made available for other cases as TB and HIV/AIDS. So these are the things we are talking about. We are not saying that okay, let's just because we know TB has medication, HIV has medication, we know how to treat malaria, let's forget about malaria and TB and HIV and then let's pay attention. No, it shouldn't be like that, because if we do that, it means therefore that by the time all energy is being put to COVID, by the time we would have finished tackling COVID, then we will start recording even double of cases of malaria, TB and HIV cases. Does it mean that people who are living with TB and HIV is their deaths are not important to us as COVID?
To the best of my knowledge, Madam Cecilia, even when we had partial lockdown in parts of the country, the instruction to hospitals, health centers, clinics, and so on was that they should still pay attention to persons who came with other, diseases, such as the ones we've been talking about here. Even at that time, even though people were asked to stay home, pregnant women, for example, were given particular schedules as to when and how to meet their healthcare providers and so on. And so, even under these times, from where I sit, yes, I may have seen a lot of attention being paid to the issues around coronavirus, but I don't see a total neglect of other diseases. You go to Kolebu today, you find doctors still attending to patients who are reporting with malaria, TB, and so on.
Yeah, it's true that the health sector or the health service providers continue providing those services, but they are the same people who provide the COVID services, and so you see pressure of work on them. And so if somebody comes with malaria and somebody with COVID, I would prefer focusing on the COVID, especially taking preventive measures before malaria. I think what we are trying to say is that it's the same system and the same service providers. But the balancing is very important so that we don't neglect one side. Because WHO, there was a study by WHO that by the time we finish tackling COVID, would have double malaria cases in this globally. I think it's just alerting the whole world to know that other diseases are there, other emergencies are there. Pregnant women go, but many of them are also afraid to go to the facilities, and so they will prefer giving birth at home. I think what we are trying to say is that yes, the country is doing well, the government is doing a lot of work, putting it a lot of effort, but the attention, the enthusiasm should continue. And we should make sure that resources, domestic resources, should be allocated adequately to strengthen our health system. I'm happy that they've given the pass for recruitment of more doctors, more nurses who are at home. I think it is just telling us that the gaps in the health sector must be filled and filled adequately. Because again, when Ebola came, we were praying. There was a lot of effort. Now, COVID has come, a lot of fear. And what is coming up now is that COVID will remain with us. How are we planning so that other diseases don't suffer? That is what we are all saying. It should be all hands on deck, and then we see how we can tackle it. Pregnant women. I know there was a plan for HIV during the lockdown. People infected, the people having HIV, they were giving 1 month drugs allocation and others. But a lot more decided not to go to the facility, and they defaulted just for fear of the unknown. And so that is why we have a lot of communication with the public, the citizen, to get the right information so that we don't just get the information in Accra. The rural areas, the needy communities should be informed adequately.
Mr. Kumah, I asked you earlier about other interventions that have already been in place for several years, and I, particularly on many of the platforms here on GBC, we've spoken about malaria control programs, malaria this, we've done several stories as to why we shouldn't leave our gutters, dirty, water, I mean, so many of the stories and programs, we've done them over the years. If in the 21st century, a disease we've known about for so long a time, we still cannot do away with it, what else can we do? Is it in the midst of conversations about COVID-19 that we can finally then find a solution to malaria, which is basically born out of dirty environments, if you like?
Okay, so I've mentioned earlier on that one. I think that's what we are. There's lack of resources. Now, secondly, we looked at when you take COVID issue and then the projections that we've been doing for the case count updates we do every day. You realize that this puts some kind of fear into the individuals. So the individual actually knows what is happening out there. So yes, 5,000 cases. Then we have maybe 31 deaths. Then people become aware, like conscious of themselves. Yes, there's something really existing. There's something really killing us. There's something really affecting people. That has not been done for malaria. I believe that, let's say, as a strategy, if we should say maybe quarterly, let's come up and say, how many cases of malaria have we recorded as a nation? How many children under 5 died as a result of malaria? How many pregnant women died as a result of malaria? And then people are seeing these figures out there. Then they begin to understand that, yes, malaria can actually kill.
Where can we get this information from?
No, as you mentioned, we have the National Malaria Control Program that works in the area of malaria. They have all this data. But I've mentioned also that even with the National Malaria Control Program, the funding reduces each year. You see, so as I was saying, if you project these figures to the individual, to the public out there, and then they are aware the havoc malaria is causing, even the preventive measures you are talking about, that clean your gutters, use your insecticide net, they will adhere to this COVID time when we were projecting. You see everybody with some hand sanitizers. People, you go to houses, they mount Veronica buckets, and then with clearly stated, wash your hands before you enter. So because
we are all wearing face masks.
We are all wearing face masks.
Not to be the case.
Yes, we are all wearing face masks because we know what is happening out there. These things are not there for the public on other diseases, malaria, TB, HIV. It's not there. So the awareness, I think, is lacking. I mean, we need to project these things for them to see as a mean. And then also we are talking about domestic resource mobilization for all this intervention. See, when COVID comes, we see all partners, all stakeholders, corporate organizations, they are donating into a COVID fund. Even the common fund for, you can find out later, the common fund allocated for malaria activities, for example, in the district, which is a 0.05 common fund allocation, does not even go to the malaria programs. They use it for something else. You see, so if, let's say, a fund, this is even at the district level, and all these things that we are talking about is all towards universal health coverage. Where we even have, when you go to the communities, we have the CHIPS compounds, we have the health centers, and then this fund can even be used, for other interventions. You see, but there's nothing like that. The money that is even allocated to malaria is not getting there. Then how would the effort of the National Malaria Control Program be complemented? So it's very difficult for them to even implement some of these activities, you see. So these are things we need to look at.
Cecilia, so moving forward, and as we begin to wrap up on this conversation now, moving forward, what are your suggestions? What kind of appeals do you have for the government, Ghana Health Service moving forward?
Yes. I think we need to invest more into preventive health and health promotion. Instead of curative. I think as a country, it seems we've forgotten about prevention. A lot is happening. And then, you see, as we set up the COVID fund, I think the whole world is moving towards domestic resources. As the partners, private sector, everybody donated, I would suggest that the government should start thinking of establishing a health fund, or call the private sector, philanthropy. Everybody should put in resources. For example, for years now we've been trying to establish HIV fund. It has never worked. And now HIV, Ghana AIDS Commission is, we don't know what they are doing now. That enthusiasm, that support that all of us, including the media. And so I would suggest that we should establish a fund that is there for such health interventions, so that we don't always focus on outside or borrowing money, but gradually everybody should contribute to that too. The reaching out to the grassroots and creating awareness is very important. If I tell you that there are still a lot of people don't know what this COVID is, it was on the TV when Ashanti region, the policeman asked a man, and the man said he didn't know that there is a disease. So there are several people who are not aware. And this is why we need to partnership with media is very important, and partnership with civil society. I don't see a lot being done. So we should invest more into preventive and save our little resources than waiting for the thing to come. I would suggest that the government should really look at health fund that everybody can access, contribute money into. All the philanthropy, everybody, private sector should put in money to own our own health. And I think that is one thing that I want to tell the health sector. And the president has promised that he will increase funding to health sector. He's ready to strengthen the health system, and I think we are happy and we look forward towards his plans to strengthen the health sector.
Mr. Kumah, closing remarks?
Yeah, so I would like to say that more attention should actually be paid to strengthening our health system as a whole. We need to have a system where we can be able to identify, some of these cases, a system that can quickly quickly respond, not just respond, but effectively respond to some of these challenges. And let's try as much as possible to always weigh the situations. Let's try as much as possible to maintain that balance, especially when we are dealing with issues of other infectious diseases, so that even as Madam Cecilia said, maybe after COVID, who knows, we might be hit with another pandemic or outbreak. And so does it mean we need to be going back and forth? No. So let's design the system in such a way that, yes, anytime that we are being hit with an emergency, other programs still continues to roll, so that we don't put the lives of others. Also, yes, people might not contract COVID, but people are contracting HIV, AIDS, TB, malaria, who are suffering from those diseases as well. So let's always find that balance between attending to all situations, even in situations of an emergency.
All right, thank you very much for coming. As the days go on, I'm sure we can expand on the conversation and have more details to talk about some of these neglected diseases, especially in this period where people, the evidence is clear now, are dying as a result of other diseases, but we're paying so much attention to just one of the killers. Thank you very much for coming, Mr. Augustine Kumah and Madam Cecilia Senoo. Thank you. We are grateful for your time this afternoon. We'll be back with more on the table. Please don't go away. When we come back, we still have a lot more to talk about. We'll talk about the recovered persons and whether or not they can reinfect others. And then schools are beginning to resume in China. China is where it all started, COVID-19, and they brought about very strict measures, including total lockdowns of some of the provinces. What does this mean to the fight against COVID-19? All that and more when we return from this break.